Welcome everyone to the 2024 Innovation Summit. I'm Tram, CEO of Bespoke Bone. I'm here to share with you our pre-seed startup looking to change your craniofacial trauma care. So first, let me introduce you to Grace Jones. She's a model. She's very famous in the 80s and 90s. She has really striking features. What do you notice about her? She has this really square jawline, high cheekbone, defined forehead, chin. All these features that make Grace Jones, they're all bony features. And it's these bony features that determine the shape of our faces and how others perceive us and how we perceive ourselves. So what happens when these features are not there? Let me introduce you to a patient. Let's call her Jane. The cheekbone underneath her left eye is gone. You notice it's very different. She has these sunken eyes, droopy chin, droopy nose. So what happens if you don't have these bony features? So can we regenerate these bony features? So imagine a world where Jane can have her bony feature back and it can continue to grow and adapt as she goes on the rest of her life. So can we regenerate anatomically correct bone to restore appearance? So to treat Jane, let's look at what's currently on the market. So the gold standard right now is autologous bone grafting. It's a process where you take a bone from a different part of the body, like the fibula, and then graft it into the face. A good analogy of this is, let's say you have a car. Your front bumper now has a big crack in it or a big hole. You're trying to fix it. You're going to take a back bumper and kind of patch it in. It's a very bad fit, right? It restores function, but that's completely wrong in aesthetics and does not restore appearance. Not to mention, this is a very difficult surgery. It can only be performed in high-resource hospitals with very skilled surgeons. Not great. However, it's considered the gold standard because it's a vascularized tissue that you're transplanting, so you're not going to get any infections or low rates of infection. Now, what happens when you don't have enough bone to graft? That's when you have your other option, which is not as good, alloplastic grafts. Alloplastic grafts are customized. It's typically 3D printed, made by companies like Kellis Martin, Synthes. While they restore appearance, they don't restore function. It's just a piece of plastic. It doesn't adapt with the patient as they age. It's important in growing patients where their bone changes as they age. So they'd have to come back for repetitive surgeries every time their bone changes. Not to mention, because it's not a vascularized tissue, there's no trafficking of immune cells to the actual wound site, so you'll get infections. And this is why it's not considered the gold standard. So is there any way that we can get a happy middle ground of these two? Let me introduce you to Bespoke Bone. So our patented technology combines the simplicity of the alloplastic graft surgery with the efficacy of autologous technologies. However, what we achieve is unprecedented regeneration. So with the alloplastic grafts, you get no regeneration. And for the bone grafts, you only get what you put there. You kind of don't get more. We get more than that, not just what we put there, but full regeneration. So let's look at our most recent preclinical data. So we're currently looking at a peak chin right here. The region in red is our region of interest. We created a wound there. So you see that little black hole there. So after 52 weeks, the wound is still there. It's not healed at all. That's not good. So let me introduce you to Bespoke Bone. After implanting our implant, 52 weeks later, it's completely healed. It's great. So how would this look like in a clinical setting? So we're using the established process of alloplastic grafts with already established insurance code. The difference is that we print bones that make more bone. So it follows the traditional alloplastic pathway where we reach out to your surgeon will reach out to us and say, hey, I have a patient, and send us their CT scan. Based on their CT scan, we would design the optimized scaffold so the patient can heal, and then sterilize it, package, and ship it to the OR in as short as 48 hours. And at the end of the treatment period, which is roughly 2 years, the graft is gone, completely biodegradable, and the only thing that's left is your own bone, fully regenerating and growing with you as you went on the rest of your life. So who are we? So we're a spin-off of JHU. My co-founder, Dr. Grayson, is an experienced scientist in the field of translational engineering. He's been in tissue engineering for 20 plus years, and this work is based on that out of the Grayson lab for the past 15 years. I'm a materials engineer by training, also cross-trained in business and economics, and I was recruited to join from my experience in medtech as well as in medical device companies. We plan to carry 2 lines of products, depending on the severity of the patient. So we do have our flagship product, which is the personalized implants, where we work in conjunction with your surgical team to develop the optimized scaffold for your injury. And in case where it's not as severe, we have these off-the-shelf implants that we've actually partnered with KLS Martin to develop based on a robust data sets of a lot of CTs for each age group, gender and race, so that it can be shipped to you as quick as possible. So we currently have a staged approach with large market opportunities. Initially, we plan to attack the craniofacial bone graft market. It's a little bit smaller, 53 million. However, it's not as much competition in the space, especially since you have this unsatisfactory unmet need. After capturing our market share as well as establishing ourselves in craniofacial bone graft market, we plan to go into spine fusion, then eventually osteoarthritis market with much bigger market opportunities but all these opportunities are pretty high CAGRs. So our pathway to clinical reformation. So we've wrapped up our most recent preclinical study in 2021, scaled up to GMP-like manufacturing this year, and have submitted our first FDA submission, the Ph.D. In the next few months, we plan to obtain more non-dilutive funding, as well as establish a manufacturing facility, wrap up our FDA submission, which is the 510(k), and do our first in-human trials sometime winter of next year. So kind of like just our 4-year key milestones that we have identified, which is to establish our manufacturing plan, achieve that 510(k) approval, to then go into our human trials. So our path of de-risking to the market is first to pilot in burr holes, which has a lot less severity, low risk of infection. It's a good way to just prove efficacy of our product. Then we plan to pilot in cranial plates, which is our first feasibility trial, first in adults and then in pediatrics, to show that our bone will regenerate and grow with the patient as they age. And then reaching our final target trial, which is the craniofacial reconstruction, which is where we will end up capturing the bone graft market. So as our team is looking to achieve our 4-year key milestones, we're looking to expand our team. We're looking for people who are interested in doing medtech or having startup experience, or maybe both. That'd be great. We're also looking to raise funding to do our pilot burr hole trials, which are slated to start next December. Feel free to reach out to any of us if you're interested, and thank you for listening to my pitch.